Hello, everyone, and welcome back to the English Camp podcast. I'm Adam, and today we're helping you with a situation almost everyone gets nervous about: English at the dentist.
And I'm Sarah. And before we start, remember to subscribe so you don't miss our other everyday English episodes. Taxis, grocery stores, banks, restaurants, doctor visits, all the real-life English you truly need. Subscribing helps the podcast grow, and it helps you follow every new lesson easily.
All right, let's get into it. And again, no story today. No characters going to the dentist. Just two teachers, you and us, and the exact sentences you need from the moment you book the appointment until the moment you walk out of the clinic.
Let's begin with booking the appointment, because this is where everything starts. Many learners freeze at this point, especially on the phone. But actually, it can be very simple if you know the key phrases.
Here's the easiest and most useful opening sentence. Hi, I'd like to make a dentist appointment. Clear, polite, soft.
Let's say it together. Hi, I'd like to make a dentist appointment. One more time. Hi, I'd like to make a dentist appointment.
Educational tip. I'd like to is polite English. Softer than I want to. It shows respect and calmness.
Now, the receptionist will probably ask, "What is the appointment for?" Meaning, why do you need the dentist?
And here are the best simple answers for real-life situations. I have tooth pain. My tooth hurts. I need a cleaning. I have sensitivity. My filling came out. I chipped my tooth. I think I need a checkup.
Let's explain a few of these slowly. Filling. The material the dentist puts in your tooth after removing a cavity. If it falls out, you say, "My filling came out."
Chipped. When a small piece breaks off your tooth. Very common. If you bite something hard, you can chip a tooth.
Sensitivity. Pain when you eat hot, cold, or sweet things. Repeat it with me. Sensitivity. One more time. Sensitivity.
Great. Now, after telling the problem, the receptionist might ask, "Is it urgent?" Urgent means serious or needs fast attention.
Simple responses. Yes, it's urgent. No, it's not urgent. It hurts, but I can wait. It's getting worse.
Educational tip. It's getting worse means the problem is increasing. Very common medical English.
Then they ask about time. Do you prefer morning or afternoon? Or when are you available?
And we answer with calm, natural English. Morning is better for me. Afternoon works for me. I'm free after 3 p.m. Anytime is okay.
Here's an incredibly useful phrase. That works for me. It means, yes, that time is okay. And it sounds very native. Let's repeat it. That works for me. One more time. That works for me.
Now, the clinic chooses a time. We have an opening at 10 a.m. Opening means available time slot.
We answer, that's fine. That works. Yes, I'll take it. 10 a.m. is good.
Then, they will ask you for your information. Almost always the same 3 questions. What's your full name? What's your phone number? Do you have insurance?
We answer, slowly, clearly. My name is. My number is. Yes, I have insurance. Or, no, I don't have insurance.
Educational tip. If you don't understand what the receptionist says, you can politely ask, "Could you repeat that, please?" Very soft, very natural.
Then comes a very common instruction. Please arrive 10 minutes early. This means come before your appointment time to fill out papers.
Say it with me. Arrive early. One more time. Arrive early.
Before the call ends, the receptionist might say, "We'll see you then," or "See you on Monday," or "Your appointment is confirmed."
We reply simply, "Thank you very much," or "Great, thank you."
Now let's go deeper, because booking a dentist isn't always simple. Sometimes you have to reschedule. Sometimes you're not sure what time you're free. Sometimes you have to cancel.
So, let's learn the English for that too.
If you need another day, you say, "Is there another time available?" Or, "Do you have anything later in the afternoon?" Or, "Can I reschedule my appointment?"
Reschedule means change the time or date. Let's repeat it. Reschedule. One more time. Reschedule.
If you have to cancel, you simply say, "I need to cancel my appointment," or "I won't be able to make it." This means you cannot come.
Educational tip. I won't be able to make it is a polite way to say, I can't come.
Now let's practice a full, natural booking call. Slow, simple English, perfect for beginners.
You? Hi, I'd like to make a dentist appointment. Receptionist. Sure. What is the appointment for? You? I have tooth pain. Receptionist. Is it urgent? You? Yes, a little. Receptionist. Do you prefer morning or afternoon? You? Morning is better for me. Receptionist. We have an opening at 9:30 a.m. You? That works for me. Receptionist. What's your full name? You? My name is... Receptionist. Great. Please arrive 10 minutes early. You? Thank you.
See? Clean, simple, no stress. Just short sentences, calm voice, easy vocabulary.
And that completes only the booking stage, but with 3 times more material, more teaching, and more phrases that you'll actually use.
Next, we'll talk about what happens when you arrive at the clinic. Checking in, filling forms, talking to the receptionist, and describing your symptoms.
Whenever you're ready, we'll move forward.
Now that the appointment is booked, the next step is arriving at the clinic. And honestly, this part scares a lot of English learners. The check-in, the forms, the questions, the instructions. But just like the booking stage, the English year is simple and repeatable.
Exactly. And today we'll go slowly and teach you every important sentence you'll hear or need to use. No pressure, just calm, clear language. Think of it like learning a small dentist survival kit in English.
All right, you walk into the clinic. The first thing you do is go to the front desk. And you say the simplest, most natural sentence. I have an appointment at 10.
Let's repeat it together. I have an appointment at 10. One more time. I have an appointment at 10.
Then the receptionist usually asks, "What's your name?" Or, "Could I have your name, please?"
You answer, my name is... Very simple.
Next, they often ask, "Can you confirm your phone number?" Or, "Can you confirm your date of birth?"
Educational tip. Confirm means check if the information is correct. Very common in medical English.
Exactly. Say it with me. Confirm. One more time. Confirm.
After this, they almost always say the famous sentence, "Please fill out this form."
This form usually asks for very simple information. Your name, address, phone number, emergency contact, medical history, allergies, and current medications.
Let's explain medical history. It means your past health problems, like I had surgery, I have allergies, I take medicine. Simple.
If you don't understand something on the form, the best sentence is, "Could you help me with this part?" Or, "I'm not sure about this question."
These sentences are soft, polite, and very natural. You're not saying, I don't know English. You're saying, I want to understand this better.
Now let's talk about the most important vocabulary from the dentist forms. Here are the words you must understand.
Allergies, things your body reacts to. Medication, medicine you take. Anesthesia, the numbing medicine that makes you not feel pain. Symptoms, what you feel, like pain or sensitivity.
Let's repeat one of them. Symptoms. Say it with me. Symptoms. One more time. Symptoms.
Perfect. Now let's continue. After filling out the form, you go back to the front desk and say, "Here you go." Or, "I'm done with the form."
And the receptionist usually responds with, "Thank you. Please have a seat. The dentist will be with you shortly."
Shortly means soon, very soon, not too long.
This is a very common phrase in medical places. "Will be with you shortly."
Exactly. And now you sit in the waiting area. This is the place where everyone acts calm but secretly feels nervous.
There might be quiet music, people on their phones, kids flipping through picture books, someone pretending to read a magazine but really just staring at one page.
Sometimes the receptionist calls your name wrong. Don't worry, it happens to everyone. Just smile and say, "Yes, that's me."
Educational tip. If you don't hear your name or you're unsure, you can ask, "Did you call my name?" Or, was that for me?
These are polite and useful. Now let's move to the most important part of today, talking to the dentist about your problem.
Inside the room, the dentist usually starts with, "How can I help you today?" Or, "What seems to be the problem?" Or, "Tell me what's bothering you."
Bothering means causing discomfort or pain.
Exactly. Now, here are the best simple sentences to describe your problem. My tooth hurts. I have sharp pain. I feel pressure. It hurts when I bite. It hurts when I drink something cold. I think I have a cavity. I cracked my tooth. My gums hurt. I feel something stuck. I lost a filling.
Let's explain cavity. A cavity is a small hole in your tooth. Very common word at the dentist.
Repeat it once. Cavity. One more time. Cavity.
Perfect. Now, if the pain is strong, you can say, the pain is getting worse. Or, it comes and goes. Or, it's really uncomfortable.
Educational tip. Comes and goes means sometimes you feel pain, sometimes you don't.
Now, the dentist might ask, how long has it been hurting? Or, since when have you had the pain?
You can answer simply, since yesterday, for 2 days, for a week, for a month, since last night.
And sometimes the dentist asks, on a scale of 1 to 10, how bad is the pain? If you don't know what to say, answer simply, maybe a 6, or it's strong but not terrible.
Then the dentist usually gives instructions. Please open your mouth. Bite down gently. Relax your jaw. Turn your head to the left. Close a little. Open wider.
These are all normal and simple. If you don't understand, you can always say, sorry, could you repeat that? Or, do you mean like this?
After checking, the dentist might say, you need a cleaning. You need a filling. You need an X-ray. You have a cavity. The tooth is inflamed. You might need a root canal.
And we will explain all of these in the next part, exactly what they mean, how to respond, and the English you need during the actual procedure.
For now, this was your complete deep guide for arriving at the clinic, checking in, filling forms, waiting, and describing the problem clearly.
When you're ready, we'll move on to the treatment stage, the big one, and teach you all the English you need inside the dentist chair.
Now let's continue with the most important part of the whole visit, the actual dental treatment. And again, we're not telling a story. We're teaching you the real sentences your dentist will use and the simple English you can say back.
Exactly. Many learners get nervous here because the dentist speaks while your mouth is open and the words feel fast. But when you know the phrases, everything becomes easier. So let's break this down step by step.
After you sit in the dentist chair, the dentist usually starts with a friendly question. How are you feeling today? This is normal, just a warm start. You can answer, I'm okay, or a little nervous, or I have some pain.
And saying I'm nervous is totally fine. Dentists hear it every day. You don't need perfect English to express it.
Then the dentist begins the checkup. You're going to hear classic instructions like open wide, close a little, relax your jaw, bite down, turn your head to the right, turn your head to the left.
Let's explain a few of these. Open wide means open your mouth big. Relax your jaw means stop tightening your mouth muscles. Bite down means close your teeth together gently.
And when you're not sure, you can ask, "Can you show me?" Like this. Very simple, very helpful.
Another phrase dentists use a lot is, you'll feel a little pressure. This means it won't hurt, but you might feel something pushing or moving.
Exactly. And sometimes they say, you might feel a pinch. This is usually said before anesthesia, the numbing injection.
Let's explain anesthesia. It's the medicine that makes the area numb, so you don't feel pain.
Say it with me. Anesthesia. One more time. Anesthesia.
The dentist might explain, I'm going to numb the area, or I'm going to apply anesthesia, or you won't feel anything after this.
Now, many learners get anxious here because they want to tell the dentist if something hurts. Here are the best simple sentences to use. It hurts a little. I feel pain. Can you check that area again? That feels sensitive. It's uncomfortable.
And here's an important one. Could you stop for a moment? That's a polite way to ask for a short break.
Educational tip. Dentists usually pause immediately when you say, stop for a moment. It's clear, respectful, and easy to understand.
Now let's talk about the actual procedures. If you have a cavity, the dentist might say, you need a filling, or you need a small filling.
A filling is the material they put inside the tooth to fix the cavity. If the cavity is big, they might say, it's a deep cavity, or we need to clean the decay.
Decay means the damaged part of the tooth. Very common word in dental English.
Sometimes the dentist needs to do an X-ray. They'll say, we need to take an X-ray. It helps us see the root. Please bite down on this.
Let's explain root. The root is the bottom part of the tooth inside your gum. If there is a deep infection, the dentist might say the root is inflamed, or there's infection near the root.
Now, let's cover a big phrase many learners fear. You might need a root canal.
A root canal is a treatment for deep infection. Not fun, but very normal. The dentist might explain, we clean the inside of the tooth. You won't feel pain during the procedure. It helps save the tooth.
During treatment, you'll also hear suction, or I'm going to use the suction.
This is the small tube that removes water and saliva. Very normal.
If you need a break, say, 1 moment, please, or I need a short break.
After finishing, the dentist usually says, all done, or you're all set, or you're good to go.
Educational tip, all set means everything is finished. Everything is ready. Very common phrase.
Then, the dentist explains aftercare. Let's go through the most useful aftercare instructions in simple English.
Don't eat for 30 minutes. Eat soft foods today. Avoid chewing on this side. No hot drinks for a few hours. You may feel soreness. Take this medicine if needed. Brush gently tonight. Come back in 2 weeks.
let's explain soreness. It means a light pain or tender feeling, not strong pain, just sensitive.
If you want to ask a question, here are great, simple options. Is it normal to feel pressure? How long will the numbness last? Can I eat later today? Should I take pain medicine? When do I need to come back?
And here's a very useful phrase. What should I expect? It means, will anything feel strange later? Will anything change?
Now let's go to the end of the visit, checking out at the front desk. The receptionist might say, "You're all set," or "The doctor will see you again in 3 months," or "We need to schedule a follow-up."
Follow-up means another appointment to check your progress. Repeat it once. Follow-up. One more time. Follow-up.
If you need a new appointment, you can say, "I need to book a follow-up," or "When is the next available time?"
Then comes the payment moment. The receptionist might say, the total is $90. Or, the cleaning is covered by your insurance. Or, this part is not covered.
If you need clarification, you can ask, "What does that mean?" Or, "Is this included in my insurance?" Or, "Can I see the breakdown?"
Breakdown means a clear list of the costs. Very helpful word.
You can pay by card and say, "I'll pay by card." Or, "Card, please." Or, "Can I tap?"
After payment, the receptionist usually says, "Have a great day," or "Take care," or "See you next time."
And you answer, "Thank you, you too." Or, "Thanks for your help."
And finally, you leave the clinic with numb lips, sore cheeks, a calm heart, and successful English.
And that is the complete, full dentist experience, from booking to sitting in the chair to aftercare, all in simple, realistic, confident English.
Take care of yourself.
And we'll talk to you in the next episode of the English Camp podcast.